Okay, if you're a 60-year-old Caucasian male with confusion and lethargy, constipation, polyuria, and calcium of 13, what's best next step?
Is is he calcium of 13
Hmm.
and symptomatic, so IV fluid
Yeah.
and then
As a
hydration.
diagnostic, so you ordered chest X-ray, you found right middle lobe mass.
Mm-hmm.
What do you do after that?
So this will be a small cell. You're gonna do bisphosphonate, right?
No,
With the special
you order parathyroid hormone like peptide.
parathyroid hormone. Okay. Okay.
Okay, if you're a 21-year-old woman,
But eventually you're gonna treat with bisphosphonate, right?
yeah, you're right. Yeah.
Hypercalcemia of malignancy.
Yeah.
Okay. Okay.
So if you're a 21-year-old woman who's injecting yourself with a lot of thyroid, so what do you
Mm-hmm.
expect will happen to the level of thyroglobulin?
Thyroglobulin, it will be low.
Yeah, will be low.
Yeah.
Now, if you're a 63-year-old male with
Mm-hmm.
4 cm thyroid nodule in the right thyroid lobe, FNA shows follicular carcinoma. Okay, so what biopsy is necessary? What do you see on biopsy to make diagnosis of follicular thyroid cancer?
What biopsy is necessary?
No, like I mean, what do you find on biopsy to confirm that it's follicular?
You have that follicular something with capsule.
Yeah,
Capsule is an extension of
yeah, an
capsule.
invasion of a tumor capsule, invasion of the
Right.
tumor capsule and blood vessels, lymph node
Mm-hmm.
involvement in papillary thyroid cancer, calcitonin in medullary, okay,
Huh?
calcitonin in medullary thyroid cancer,
Uh-huh.
samoma body in papillary,
Mm-hmm.
Hurtle cells in follicular and papillary both. It's not, yeah, it's Hurtle cell, I think it's low yield. I don't think they're gonna ask. Okay, now,
It's not low yield. Come on, Dr.
huh?
Ali.
What is,
Just give everything.
huh?
There's nothing like low yield.
Yeah,
You never know.
that's true, yeah, that's true. Now, if you're a 29-year-old woman with nausea, vomiting, anorexia, your Na is 130, potassium is 6,
Which one is 130?
sodium,
Sodium?
sodium, I mean, yeah.
Mm-hmm. Mm-hmm.
And you had a mucosal pigmentation. So what is causing your issue? You live in the United States, you never left the United States, and you had
Mm-hmm.
Hashimoto. So what could be causing your adrenal insufficiency here?
So I remember we said that is okay. Nausea, vomiting, anorexia, sodium, hyperpigmentation. So hyperpigmentation, secondary adrenal insufficiency.
Yeah, here, like I'm
What
discussing,
question are you asking?
I'm talking about the cause. Just keep in mind, like, people who are here in the United States, most common cause is autoimmune
Mm-hmm.
adrenalitis,
Mm-hmm.
while in outside of
Wide
the,
what is TB?
yeah, worldwide is TB. Yeah.
Mm-hmm.
Now, you're a 23-year-old African American male. I gave you antibiotic for UTI,
Mm-hmm.
and then you came to me and said, "What the hell did you do to me? My urine became dark."
Mm-hmm.
So what's causing that?
G6PD?
Yeah, oxidative stress. Yeah, the urine
Mm-hmm.
sample stained positive with a Prussian blue stain.
Mm-hmm.
Okay, so that's G6PD. Now, so someone you says have a lot of have BMI of 28 or hypertension. Okay, he's 45. So what does the order to screen for diabetes?
To screen.
Mm.
So.
Especially his blood pressure is 140/86.
So if you're gonna screen, you can do either you do fasting, or you can do hemoglobin A1C, right?
Yeah, you can do 2-hour glucose tolerance test too. So they recommend screening anyone who have blood pressure more than 135/80. You screen them for diabetes. Okay. Now you are a 55-year-old male who have an ulcer on the sole of the right foot. So what's causing this ulcer?
Sole of the right foot. Maybe diabetic ulcer.
Yeah, diabetic neuropathy. You want to differentiate that. You remember we had that like in the heel, sacrum, and ear. That's a pressure ulcer. Okay, but on the soles of the foot, that's a diabetic ulcer. Okay. Yeah, that's it. Just
You say on the heel. Where else?
Sacrum and ear lobe.
Okay, pressure.
Okay. Now, if you're 65-year-old Caucasian male who have bilateral foot pain that worsen at night, your physical exam shows bilateral loss of ankle deep tendon reflexes and loss of vibratory sensation. Okay, so how do you treat this condition?
Bilateral foot pain, loss of vibratory.
Yeah, your HbA1c is 9. I'm gonna make it easier for you.
Yeah, it's diabetic and nephropathy.
Neuropathy. Yeah, what do you do? How do you treat that?
Okay, how do you treat that? Gabapentin.
Or
you can do gabapentin. You can do what do you call it? Pregabalin, Lyrica. Or you can do what else can you do for neuropathy? You can do. I think you can do TCA.
yeah,
Which one?
amitriptyline.
Amitriptyline.
Yeah, you can
Right.
65-year-old male. If you are a 65-year-old male with decreased appetite, nausea, abdominal bloating, and type 2 diabetes, you have long-standing type 2 diabetes, abdominal bloating, nausea, decreased appetite. How do you treat that?
Decreased appetite, nausea, vomiting type 2. It can be two things. It can be like gastroparesis.
How do you treat that?
You do metochloropromide,
Yeah.
Reglan,
Yeah.
or you can do erythromycin.
Yeah, or you can even go do cisapride.
Which one?
They call it cisapride.
Okay.
Yeah, but metoclopramide and erythromycin. Yeah. Damn, that nap that I took, wow, it was like refreshing. I feel so much better now. Yeah, it's really good. Like,
Do you take nap every day?
I try. Yeah, sometimes
That's
like when
good.
it's good like to take nap in the middle of the day, refresh your energy.
I can't.
Really? Why?
I don't know. If I do it, I'm not gonna sleep well at night.
Oh, I see. Yeah.
I have to keep going till I crash and sleep. And
yeah, makes sense. Yeah. Okay, so if you're a 45-year-old female with hirsutism, temporal balding, okay, and terminal hair on your face, what best next step?
temporal balding, terminal hair on your face.
You're obese too.
I'm thinking two things. I don't know. So it can be PCOS. It can be.
What? Yeah. So we order testosterone and dihydroepiandrosterone. Okay, just to see this one because this is rapidly developing hyperandrogen. Sorry, rapid virilization.
It can also be tumor, right?
It can be androgen secreting tumor. So you do labs first. Okay. Okay, yeah. Now, if you're a 32-year-old woman Okay, you had a potassium of 5.6, sodium of 131, and there is skin hyperpigmentation. Okay, so what's going on here?
Adrenal insufficiency.
Yeah, autoimmune adrenalitis. Yeah, that's the thing. So
Secondary. I say secondary.
So what's gonna happen to the aldosterone level in the primary versus secondary adrenal insufficiency?
Oh my.
The library will close at 6 p.m. No materials will be checked out after 5:45, and reserved materials must be returned by 5:45. All financial transactions, including
Okay.
and taxing, have now ended.
Oh, okay. Go ahead.
Yeah, aldosterone will be normal.
Okay, aldosterone will be low in primary, and then secondary will be normal.
Good job. Why?
What is it again? I think in the primary, because the problem is in the adrenal gland,
Yeah,
affecting.
good job.
Yeah.
Yeah. Okay. The best test to order for DKA is the serum anion gap. Okay, just keep that in mind. So how do you manage? How do you manage DKA and HHS?
I think it's the same thing, that I said. The management is really not different.
Yeah. So when do you switch to subcutaneous insulin?
Is it not when the glucose is now like 250?
Yes.
Okay, you also when the anion gap is closed, right?
Yeah. So first you give them IV fluid, and you give them IV insulin, and then you switch to subcutaneous insulin when able to eat, glucose less than 200, anion gap less than 12, SCO3 more than 15, and you make overlap subcutaneous and IV insulin for 1 to 2 hours, and that's it. When do you add IV potassium?
If their potassium is less than, I think, is it less than 5.3? I don't remember.
5.2, good job, yeah. When do you hold insulin?
When do you hold insulin? If their potassium is, I think, less than 3.3, right?
Good job, yeah, 3.3. When do you give bicarbonate?
Oh, that one. I think when the pH is less than, is it less than 3 or less than?
Less than 6 point, pH less than 6.9. When do you give
pH? Oh,
yeah.
No, hold on. Do you say pH?
Yeah, pH less than 6.9.
Okay.
When do you give phosphate?
I don't know.
When the phosphate less than 1, when there is cardiac
Really?
dysfunction, yeah. When there is respiratory depression, okay, and monitor serum calcium frequently, that's important.
Okay, hold on, let me see what you said. So you add phosphate when the phosphate is less than 1.
Yeah.
And then what else? Okay.
When there is cardiac or respiratory depression.
Okay. All right.
What thyroid cancer associated with radiation?
Yeah, papillary.
Papillary. If you keep HbA1c less than 6.5, reduce risk of which of the following complication? Retinopathy. It's a microvascular complication. Doesn't change the macro, okay? Okay. If you are a 32-year-old male with impotence and absent morning erection, okay? So now, and you had a pelvic fracture with urethral injury. So what caused this erectile dysfunction?
Oh, what is causing that?
Yeah, that's a trauma. Can damage when you have a trauma. Damages. This is called neurogenic erectile dysfunction. There's vascular, there's psychogenic, and there's neurogenic. Okay, how do you? So if you have abdominal cramps, flushing and wheezing, and diarrhea.
Abdominal cramps, flushing, wheezing, carcinoid.
Yeah, you have deficiency in what vitamin?
Vitamin, that will be niacin.
Yeah,
B3.
that's why you may have dermatitis, diarrhea, and dementia.
B3, right?
Huh? Yeah.
Is it B3?
Nielsen? Yeah, I think so, yeah. You have
B3.
telangiectasia, cyanosis, diarrhea, cramping, vulvar lesion, right more than the left. The way you diagnose it, you order 5-HIAA, CT, MRI, octreoscan, scan, and echo, okay, if there is carcinoid heart disease. The treatment, you give octreotide for symptomatic. And when do you do surgery? If there is a liver metastasis,
Okay.
okay, you do surgery. Now, if you have a potassium of 2.6 and muscle cramps and sodium of 147, what test do you order?
Okay. So you do the renin aldosterone ratio.
Yeah, you check renin activity and aldosterone when you have hypertension and hypokalemia. Okay, this have hypertension too. So if normal, evaluate other causes. What if it's increased? Aldosterone to renin ratio is increased.
You
What
do
do
the saline suppression test.
adrenal suppression test? Yeah. What is if it's positive? What do you do?
Then if it's positive, now you want to do like a CT scan to
Imaging,
try
yeah.
to locate.
What if the CT was normal or age more than 40 with abnormal CT? What do you do?
You do that, what do you call it? Divinal something sampling, blah, blah, blah. That's one.
Yeah, good job. We do adrenal venous sampling. What if it's bilateral? Adrenal
If
hyperplasia.
it's bilateral, of course, you don't want to remove it. So you do medical management.
How about if it's unilateral?
Unilateral, then maybe adenoma, you can go ahead and do surgery.
Surgery, yeah. Now, if you are a 45-year-old woman with weakness, diffuse bone pain, parathyroid hormone of 122, alkaline phosphatase of 234, phosphate of 2.6, okay, what's your diagnosis?
You were so fast. Weakness, parathyroid, elevated.
Weakness, bone pain, increased parathyroid, increased alkaline phosphatase. What is that?
Oh, okay. Your primary.
Yeah, this is osteomalacia.
Osteomalacia.
Because there's bone pain.
Really?
Yeah, it's caused by malabsorption, bypass surgery, intestinal bypass, celiac supero, chronic liver disease, kidney disease, okay?
What's the difference between osteomalacia and vitamin D deficiency?
The same, it's the same. It's caused by vitamin D deficiency.
Okay.
Okay, yes. You'll have pseudofracture, you'll have decreased 25-hydroxy vitamin D, decreased calcium, decreased urinary calcium, increased alkaline phosphatase, increased PTH. Symptoms, you have bone pain, muscle weakness, muscle cramp, difficulty walking, and waddling.
You didn't give me the calcium level, right?
Calcium is 9, so it's,
yeah.
it's normal.
Okay, keep going.
Wow. Sorry, I'm running because I got 2 questions for you and then library is going to close. Okay, now, if your parathyroid hormone is increased, okay, and the 24 urinary calcium is 325. So what do you do right now? And there is decreased bone mineral density. How do you treat this condition with hypercalcemia? So there is primary hyperparathyroidism with urinary calcium of 325. How do you treat that condition?
So you start with correcting the symptoms, what is going on right away with IV fluid and all that, and then eventually I think they're going to need surgery.
Yeah, surgery. That's
Yeah.
definitive treatment, right? Yeah. Cause renal stone, bone, and stuff like that. Urinary calcium.
And depending on the age too.
Yeah, the clues for that: urine calcium over creatinine more than 0.02. Bone mineral density to evaluate for osteopenia and osteoporosis. You do that. 3-dimensional system MEB plus ultrasound shows hyperactive parathyroid tissue prior to surgery. You can do that. hypercalcemia with elevated or inappropriately normal PTH. So that's how this is present. Okay. So 17-year-old guy, he's been in the ICU for 4 weeks. He developed hypercalcemia. What could cause that?
Immobilization.
Yeah, immobilization. Wow. I don't know if I can do rapid review. Let's do rapid revision really quick because library gonna close soon.
Okay.
So we talked about thyroglobulin level, how it's gonna change with exogenous thyroid. Talked about follicular carcinoma. And we talked about autoimmune and TB, causes of adrenal insufficiency. We talked about the screening for diabetes if the blood pressure more than 135. Ulcer in the sole of the foot, that's a diabetic ulcer. Amitriptyline gabapentin for peripheral neuropathy. Metoclopramide for gastroparesis. Testosterone DHEA for sudden virilization. We do that. Aldosterone normal in secondary adrenal insufficiency, but decrease in primary adrenal insufficiency. DKA, we give potassium if it's less than 4.2, and give bicarbonate if pH less than 6.9, and phosphate if it's less than 1. Okay, and yeah, you can have neurogenic erectile dysfunction if you have a fracture to your pelvis. Carcinoid, we treated with octreotide and surgery, and they cause niacin deficiency. Hypertension with hyperkalemia. First, we do aldosterone to renin. If it's elevated, we do adrenal suppression test. If it's positive, we do imaging. If it's normal, then we do adrenal venous sampling. This is the last resort, adrenal venous sampling. Okay. If it's bilateral, medically treated. If it's unilateral, surgical. When you have bone pain with an increased alkaline phosphatase, that's most likely osteomalacia. Okay. If you have urinary calcium more than 250, then you most likely have primary hyperparathyroidism. If you've been in the ICU for 4 weeks, that's most likely immobilization causing condition. Endocrine is one of the interesting field, and it's kind of tricky to see what else would we do. Nephrogenic diabetes insipidus cause normal serum Na. Central has high serum sodium. Okay, let's see what else. Okay. Foscarnet and acute alkalosis, tumor lysis syndrome can cause hypocalcemia. Those are the things. Let me see what else that we need to do. Hypomagnesemia can cause hypocalcemia. Okay. So you gotta correct calcium before, magnesium before calcium. Vipoma, we do VIP level first, and then we do abdominal CT. Take the tumor out. They have diarrhea, hypokalemia, and stuff like that. If you have lung mass with hypokalemia, that's most likely small cell carcinoma causing Cushing syndrome. If you have small testes, most likely testicular testosterone deficiency. Okay. If you have diffuse bone pain, with foul smelling stool, that's most likely chronic pancreatitis causing vitamin D deficiency. Pituitary adenoma, hypogonadotropic hypogonadism in men can be caused by narcotic, diabetes, steroid, and obesity. Just like obesity in female cause anovulation can cause hypogonadotropic hypogonadism. If you follow strict diet and you're using a lot of supplements and presented with constipation, then most likely vitamin D toxicity. And that is it. Thank you for listening. Now the library is gonna close. They're gonna kick me out soon. Okay, so do you have any other questions, concerns?
So what time tomorrow?
That's good. Are you able to make it at night?
You're not gonna be tired, right?
No.
Take a nap
What
before you
time?
start.
Yeah, yeah. At night, are you guys able to make it at night tomorrow, maybe?
What time? What time?
Like 9 p.m. I'll keep you posted, actually. Yeah, I'll keep you. But you're,
If you can do earlier than that, that's fine. Just,
yeah.
you know,
But you can do the night one, nighttime, right?
tomorrow, yes, I can.
Okay, so I'll keep you guys posted. Let me see my schedule, maybe. If,
Okay, just confirm the time then.
Okay, you guys have a good day.
All right, you too.
You-
All right.